Well, good morning, everybody. Thank you for joining us for a very important, very timely webinar about heat. I hope everybody from wherever you're joining us from is hopefully enjoying the heat, not to make that too much of a dirty word as we go on with this webinar today. My name is Chris Lamb. I'm the president and CEO of the BC Lung Foundation. And we have the privilege to be joined today by two experts who I'll introduce to you shortly. But first of all, I want to acknowledge the land from which this is being broadcast to you from. The BC Lung Foundation office is on the unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh Nations. It is important for us to acknowledge, of course, the land, the environment, and mighty Mother Nature. Mother Nature playing a strong role in how we are enjoying or not enjoying our climate these days. Let's not be naive about anything. We know that heat is going to have tragic outcomes on human health, particularly for the 1 in 5 who are living with some sort of lung disease. But luckily, we have a panel of experts, like I mentioned earlier, who are going to walk us through what that means for us, and more importantly, what each of us can do about it. On our website, there is some additional information with some tips on how to beat the heat. You can find that at bclung.ca/heat preparedness. Why don't we get right to it? I want to introduce you to Megan Straight. Megan Straight is a project coordinator and analyst with Vancouver Coastal Health, their Healthy Environments team. And she's been working on the development of extreme heat resources and training. Also joining us for the question and answer period today is Emily Peterson. She's an environmental health scientist, also at Vancouver Coastal Health. So I'll turn this over to Megan now. Thank you for joining us, Megan.
Great, thanks so much, Chris. Okay, let me just pull my screen up here. Give me a moment. Okay, if I can get a thumbs up if you guys can see that. Perfect, thanks so much. Okay, almost there. Okay, so I work with the Vancouver Coastal Health Healthy Environments team. We work to address the upstream physical and environmental determinants of health using health evidence and data to support decision-making and our community. Some of our areas of work include air quality, transportation, built environments, severe weather, and emergency preparedness and response, which is a little bit of what we're talking about today. We also work closely with other VCH or Vancouver Coastal Health public health teams. Before coming to Vancouver Coastal Health, I worked in community doing pre-hospital care training. Now I'm over at the Health Authority, and I've been spending the spring working with community organizations to develop extreme heat resources and training. I'm excited to share some of my work on heat check-ins for vulnerable populations, as well as evidence-based best practices for extreme heat and wildfire smoke. I want to acknowledge Dr. Sarah Henderson from the BC CDC and my colleagues from the Vancouver Coastal Health Healthy Environments team, Dr. Michael Schwant and Emily Peterson, all of whom have contributed to some of the science around this work in British Columbia. To start off with, I'm grateful to be presenting today from the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. Vancouver Coastal Health operates here as well as on the territories of 11 other nations. Okay, today, so we'll be looking at extreme heat, some wildfire smoke events as well, including lessons learned from last summer, heat vulnerability, or heat vulnerable people and spaces, heat and smoke related illness, as well as actions to prepare and respond to these events. One of my goals today is that each of you will leave with an extreme heat preparedness plan. Maybe you create a plan for yourself, maybe it's for a family member, or if you're a clinician joining us today, considering maybe how you would help a client fill out their heat plan. Mental notes are great, but if you prefer to follow along and write down your plan, I encourage you to pull up the Prepared BC Extreme Heat Preparedness Guide so you can follow along. In healthcare and in emergency preparedness, there's a lot of jargon and acronyms. I think it's always helpful to get on the same page. And we'd had feedback from last summer that that was one of the confusing parts for our community during the heat dome was sort of people not understanding the terms that were being used. So let's clarify what's meant by extreme heat. Here are some examples you may have heard, and they're all used to describe higher than normal temperatures. So to begin with, these are terms used by by Environment and Climate Change Canada. Special weather statement is a term used to indicate uncertain weather conditions that need further explanation. It's a term used for all different types of weather, not just for heat. For example, weather that is unusual for the region. So in the spring, we actually had a special weather statement because we had higher than normal temperatures here in BC. That was sort of earlier this year in June. Heat domes are also a weather feature that we see. We experienced one last summer. It's a high pressure system that acts like a lid, trapping hot air underneath and causing temperatures to build to extreme levels. They're historically more rare, but they're becoming more frequent with climate change. Keep in mind that heat domes are only one of the causes of extreme heat. Extreme heat events and heat waves are both terms people use for this sort of a similar thing, hotter than normal temperatures that last for an extended period of time. Last summer, there was confusion about the terminology and how dangerous the heat wave or heat was becoming. In response, there are now 2 official terms for extreme heat in British Columbia that will be used by governments, health authorities, and Environment Climate Change Canada. Both of these terms indicate temperatures that may be life-threatening, but heat emergencies are dangerous for more people in the community. Later in the presentation, I'll cover who's at risk for these 2 different events, and then also criteria for these to be put into place. So what did we learn from last summer? For those who live in BC and have been here for some time, you'll appreciate that temperatures in June last summer or 2021 were well above the seasonal norm. And as the news report here shows, some were even historically high temperatures. This particular heat event was caused by a heat dome. The 2021 heat dome had tragic results. The BC Coroner's Service reported that at least 619 deaths occurred due to the extreme heat. Depending on how deaths are reported and classified, there are likely even more deaths attributed to this event. So what are some key takeaways from the evidence and local data that's emerged since last summer? The BC Coroner's Service reported that 98% of the heat-related deaths during last year's heat dome occurred indoors in a residence. These are deaths in the community, but they also are an opportunity for us to take action. And, it's an opportunity for us collectively to try to prevent some of these deaths in the future. If it's in a community setting, these are all things that we could potentially have more control over. Of those who died, 56% lived alone. Can we think about the touch points in the community? Who may have seen these people, and how can we reach out to isolated people like them in future? The highest number of deaths were the day after the hottest day, and deaths continued even as the temperatures were dropping. This is likely due to the cumulative burden of heat. It was hot all day, and then it was hot all throughout the night as well. So that doesn't really give your body much time to recover. And while our bodies are in heat, they're under stress. They're working really hard to try to cool down. This buildup of stress is what we consider that cumulative burden of heat, that impact of being in heat for days on end. For some, their bodies can manage this stress. Others may struggle to cope, and pre-existing health conditions may be impacted. What this means is that we need to continue to check on people, even if temperatures start to drop after a heat event. Heat impacted neighborhoods differently. So here we've got a picture of Vancouver from last summer. The lighter and red colored areas had the most ER visits, so emergency department visits. Those match areas of the city with less green space, more concrete, and lower income levels. So there was a number of emerging themes that we saw from the heat dome. So deprivation, so that refers to people who are lower socioeconomic level, people with isolation, as we mentioned, people who lived alone fared worse in the heat dome. Mental illness, there was quite a significant amount of people with mental illness like anxiety, depression, schizophrenia. Substance use, so people who use drugs as well as alcohol, and people with different medications, and comorbid diabetes, so that's people with diabetes as well as other conditions together. There was also protective factors that we found through the heat dome last year. So privilege was found to be protective. So if you think of people who can afford to buy air conditioning, or may be able to afford to take leisure time during the day to go to a cool space and don't have to work in a hot environment for day after day. Green space was also found to be protective. So like that map showed us, areas in the city that had, tree coverage, tree canopy, or sort of better designed buildings would have been more protected. Also being in care. So there was deaths within long-term care and residential care facilities, but there was significantly less compared to those age groups within the community. So being in care is likely protective. We think of that, people who are in long-term care facilities have people checking on them regularly. There's seasonal readiness plans for these facilities, which are sort of, more than we might have in a community setting. As I mentioned, there is now new terminology in BC. We've always had heat warnings, but we now have this new additional level, extreme heat emergencies, to try to communicate the risk that's associated with this heat. This chart shows the estimated increase in deaths for each type of event and historically how often they've happened. Keep in mind that with climate change, extreme heat events are expected to become hotter, more frequent, and longer lasting. Climate change mitigation, so prevention, as well as adaptation and resilience, are now extremely important for health. Another change that came from last summer is that the Alert Ready system is now going to be activated for that highest level of heat emergency, those extreme heat emergencies. This is the same system that's used for Amber Alerts, where they send a message to your phone. They also broadcast over television and radio. We talked a bit about some of the risk factors that came out from last year's heat dome, and that's helpful to understand. But we also want to look at what are the vulnerabilities and the resiliencies as well that contribute to heat vulnerability. So what are the physiological, social, and environmental vulnerabilities to heat? People may experience more than one type of vulnerability, and it's often a result of systemic inequalities and marginalization. Physiology or physiological refers to our bodies. So as we saw in the heat dome, some populations were more susceptible to this heat. Factors include age, medical conditions, acute illness like infections. Older adults may be less physically able to regulate their temperatures and may be less able to recognize when they're dehydrated or they're overheating. Some medications or drugs can warm the body's temperature or disrupt the body's cooling processes. If you'd like to know more about how the heat may impact you, if you have medical conditions, for example, we recommend speaking with your healthcare provider or pharmacist. If you're having trouble getting in to see them, you can also call HealthLink BC at 811 to speak to a registered pharmacist. They're available every day from 9 to 5. On the flip side, there are also protective factors that help us manage heat, things like acclimatization. So even over the summer months, we adapt to the heat and we're better prepared for a heat event later in the summer compared to one that we might experience early on in the spring. Social vulnerability also impacts outcomes in the heat. Systemic inequalities, marginalization, and stigma may impact people's access to services or cooling facilities. For example, someone who's faced stigma in health services may not feel safe calling 911 if they have heat-related illness. People experiencing low income may not be able to afford air conditioning or may not have the leisure time to go to a cool space, as we mentioned before. There's also environmental vulnerability, which refers to the increased risk some neighborhoods might experience based on how they're designed. Think of that map of Vancouver. Features like sparse vegetation, darker roofs, lots of concrete are all things that heat up a neighborhood. This is often referred to as the urban heat island. These images here show the urban heat island. So the one on the left is New York City, and you can see that it's really red around most of it. That's sort of where there's lots of concrete buildings. It's quite hot. That blue strip in the center is Central Park. So you can see that that green space is having a cooling effect. The image on the right is Vancouver and the North Shore. Dark red and purple are the hotter temperatures and green is cooler. You can see that in downtown, industrial areas, and areas in the southeast, they're hotter based on sort of how those neighborhoods are designed. There's also less green space. You can also look that across the city, we have green space that's sort of unevenly distributed. There's sort of more parks in certain areas of the city than others. Now that we've learned about heat vulnerability, let's take a moment to fill out this first step of our heat plan. So thinking about who you may know and who would be best to care for that might be heat vulnerable. Maybe you're someone who might identify as one of those populations. Don't worry, that's why we're preparing. So I will note that this list here of who's at risk during heat, there has been some updates. So with Vancouver Coastal Health, the BC Centre for Disease Control, other health authorities, and our colleagues here at BC Lung, they are recognizing that there's increased risk during heat over the age of 60. Although Prepared BC has over the age of 65 here. So just taking a moment to think of who this list might apply to. Do you have people in your life, family members, friends, neighbors, coworkers that would be considered heat vulnerable? And are those people that you could look out for during a heat event? We talked about the broader environmental vulnerability, but let's look more closely at the spaces we live in. These are all features that contribute to the heat risk in our spaces. So no mechanical cooling, so no air conditioning or heat pumps, higher floors of buildings, living directly under the roof, south or west facing windows, large window surface areas. If you've got one of those big sliding glass windows, single paned windows, no external window shading, no evening cross breeze, and low neighborhood greenness. If this is your home, you're in good company. Many homes in BC, my home included, my apartment, were not designed, were designed more for milder climates. We weren't designed for heat. So step 2 of our heat plan, if we think about those features that we just talked about, how do we evaluate if it's safe for us to stay in our homes during an extreme heat event? Can you think about the space that you're in? If you have a number of those factors, you might want to consider trying to find cooler zones in your home, or maybe moving somewhere else. Cooler zones that might be, do you have a basement you could move to? Is there a cooler room that you could spend a couple days in? Can you adapt that space to be able to kind of spend most of the day there compared to hotter areas in your home? Step 4 of our heat plan, we're trucking along here. We want to make plans for going to cooler spaces nearby, especially if you're living in one of those spaces that has a number of those factors that put us at higher risk during heat. Does anyone remember what their temperature in their home was last summer? Pop it into the chat. I'm sure many of us are curious. My apartment got up to 38 degrees. So we were lucky that we had family we were able to go stay with. So if you think about those social vulnerabilities, we also have social capital. So is there, people that we can rely upon during heat events? That's, many of those people that didn't fare as well during the heat dome last year, they were isolated. They didn't have family, friends, or people that they can reach out to. So do you have family, friends, neighbors, people that you could stay with? Is there, if not, what's in your community? Is there a cool park, swimming pool, community center, mall, coffee shop you like nearby? Remember, the longer that you can stay there, the better. Consider bringing activities and food so you can ideally spend hours at a time there. So we know a bit about who's more vulnerable in the heat. Let's look at the signs and symptoms of heat and wildfire smoke related illness.
Here's a simple question. What happens to our bodies when it's hot outside? We sweat, maybe get tired or even dizzy, but why is this happening? It's because our body has, for lack of a better metaphor, an internal air conditioning unit. As the temperature rises around us, that AC unit kicks in and keeps us cool. We all know what that feels like.
We notice sweating happening as the body's trying to get rid of that excess heat.
The human body is around 60% water, and it's spread out in different areas. It begins tapping different water reserves from places like the bloodstream, fat, muscles, kidneys, to maintain our normal bodily functions. As the body continues to get warmer, the heart pumps faster, bringing blood closer to the surface of the skin. The capillaries dilate, and your skin turns pinker. Then begins the beloved sweating process.
These glands have little ducts to carry the sweat or perspiration to the outside air.
The sweat seeps through our pores and evaporates, taking heat away from our body. This is when your mouth might get dry. That's actually your body telling you that your blood pressure has dropped and you need to drink more water.
Just recently, I was at a wedding that was outside and everyone was sweating. As soon as the wedding ended, we all went to stand up and everybody got a little bit lightheaded, and that's exactly the body, adjusting to that pressure change.
But for children under 4, that AC unit isn't fully developed, and for people older than 65, things like medications or illness could make it not work as well as it should. Symptoms like muscle cramps or nausea are early warning signs of heat exhaustion or heat stress. But for some, a more alarming symptom is when you stop sweating. That means you're entering a heat stroke. That's when your body gets hotter than 104 degrees. It starts shutting down and sees damage to vital organs like the kidneys and the brain. The way to stay cool in hot weather is a bit intuitive. Give that AC unit a bit of coolant with some water or a sports drink with electrolytes. If you're hot, help your body save some of those reserves by relaxing in the shade, or if you can, go to a cool place like a movie theater. Your body's already trying to beat the heat. If you want to stay comfortable, just help it out.
It's a little bit about what happens to our bodies in heat. So let's think a bit about what is heat-related illness. During heat warnings, heat emergencies, and even on typically hot British Columbia summer days, it's helpful to know the signs of heat-related illness. In my past life, I used to work as a lifeguard on the Vancouver beaches, and I saw people with heat-related illness every summer, even when we don't have heat warnings in effect. Heat-related illness, sometimes referred to as heat stress, is an umbrella term used for conditions caused by heat, such as heat rash, sunburn, heat cramps, heat exhaustion, and the most severe, heat stroke. Here are some of the signs and symptoms of heat-related illness. On the left-hand side is heat exhaustion, where your body is beginning to get overheated. So you're seeing things like skin rash, heavy sweating, dizziness, nausea, headaches, difficulty concentrating, extreme thirst, darker urine. This is more serious because heat exhaustion can quickly progress to heat stroke, which is a medical emergency. Try to move them somewhere cooler, give them fluids, and cool them off with water. Put them in a cooler shower, for example. Maybe have them have a foot bath, put cooler clothing or wet clothing on top of them. When we were beach lifeguarding, we used to actually stick people into the shower, turn the shower on, or throughout the day to keep ourselves cool, we'd actually dunk our uniforms in the ocean and constantly be wearing wet shirts to stay cool. Neurological symptoms like fainting, decreased consciousness, confusion, or lack of coordination indicate that they have possible heat stroke. So they've progressed to those symptoms on the right, the more severe symptoms. These are things that we want to seek medical attention for as quickly as possible. So going to urgent care or an emergency department, or if necessary, calling 911. While we're getting someone there, we're trying to cool them off as quickly as we can using water. So can we soak that shirt as we're getting them there, or can we keep them somewhere cool as we're transporting them, or while we're waiting for an ambulance? Wildfire smoke is also has impacts on our health. So wildfire smoke is a mixture of different pollutants. It depends on what's burning and where it's burning. Wildfire smoke includes fine particulate matter, some including PM 2.5 that you might have heard people talk about, and also gases like carbon monoxide, nitrogen oxides, volatile organic compounds. Wildfire smoke can cause respiratory illness or issues like coughing, shortness of breath. It can also increase risk of infections like pneumonia. There's emerging research showing long-lasting effects of wildfire smoke from multiple exposures or even just from one season. For example, there's one study from Metz et al., and their information is at the bottom there if you're wanting to look that up. They estimated that Metro Vancouver experienced 100 acute premature deaths due to wildfire smoke PM 2.5 exposure from just 2 wildfire seasons. So why is PM 2.5 such a hazard? We hear people talking about this. What's the issue with PM 2.5? They often contain a number of chemicals, and those particles are tiny. The picture shows a strand of hair. If we're looking at that, the gray part is the human hair. And in comparison, the PM 2.5 particles are that tiny row of pink that's in that blue row of dots on our strand of hair. So they're incredibly small. They're small enough to get into our airways, into our lungs, and even into our bloodstream, causing inflammation and other severe impacts. Here are both the common and more severe symptoms of exposure to wildfire smoke. You may notice at the top that many of the populations who are vulnerable to heat are also vulnerable to smoke. Similar to heat-related illness, the common symptoms on the left are an opportunity to take action to prevent more severe symptoms that we have listed on the right. People with severe symptoms like shortness of breath, chest pain, heart palpitations need immediate medical attention. So go to urgent care, emergency, or call 911. We're often asked what to do when there's potentially competing priorities. So what do we do if there's both smoke and heat events, especially as many of the same populations are susceptible to both? For example, do you open a window to cool down during a heat event if there's smoke outside? The goal is ultimately to prevent both by having both cool and clean air. But if that's not possible, generally heat is the more immediate risk, and that should be prioritized. So trying to cool off should generally be prioritized over dealing with smoke. If you have additional questions, say about medical conditions, for example, and whether or not that might be a bit of a different recommendation for you, we always recommend reaching out to a healthcare provider. And there's also further information on the BC Centre for Disease Control smoke webpage about air filtration, homemade air filters, and also air quality advisories and the criteria for those in our region. So let's talk about some actions to prepare and respond.
People living in close communities do better in climate change-related events. In the 1995 Chicago heat wave, low-income African-American communities where people didn't know their neighbors saw increased death rates compared to equally impoverished Hispanic neighborhoods. The difference was the social inclusivity and openness in the Hispanic areas. We need to find innovative ways to bring neighbors together. We need to build cities where people can feel safe and get to know their neighbors in walkable neighborhoods that feature parks, community shade spots, and other communal spaces for all to enjoy. Heat health plans work. In Montreal, strategies such as water distribution, hot day visits to socially isolated people, moving care facility patients to air-conditioned rooms, and monitoring workers in warm environments have been effective in lowering the number of heat-related deaths on extremely hot days. People living in close communities do better in climate change-related events.
So we're back to our heat plan. As the video mentioned, we saw a number of folks who died last summer that lived alone. Social connection is so important in emergency situations. So step number 5 of our heat plan is trying to find a heat buddy. So keep in mind, you may not be heat vulnerable yourself, but maybe there's someone that you could be looking out for. Maybe someone who lives alone. Heat buddies are someone who can check on each other. They can help each other stay cool and sort of, modify their space potentially. Maybe help them get transportation to a cooling space. So who would your heat buddy be? Would it be family, friends, neighbors, roommate, coworker, building manager maybe? Is there someone else? If you think of a different one that we haven't included, maybe pop it into the chat. Maybe that'll help inspire someone else to figure out who their heat buddy will be. Maybe consider hosting a neighbor event where people can work through the Prepared BC Guide together. Everyone has unique strengths that they can contribute during an emergency, but some may also need help, and we all need help at different times. For example, my father has mobility issues that were impacted by a stroke a while back, but he's also a retired paramedic and he has an AED at home. So if we think about him in his neighborhood context, his neighbors know to look out for him and help him out at times, but they also know that he's got an AED and he can help when there's an emergency. As my colleague Katja Tynan at the City of Vancouver says, it's not just about what's in your emergency kit, it's also about who is in your emergency kit. After last summer, heat check-ins are seen as an important preventative action that may save lives during extreme heat events. I spent April and May meeting with community organizations to learn about their interests, capacity, and resource needs for running heat check-ins. But before we discuss that, what is a heat check-in? So it's a visit, a call, or a text to someone to find out the heat-related safety of their home environment, and also check if they show signs of heat-related illness and if they might need help. Who can do a heat check-in? Anyone. It doesn't require health training, and it may be done by organizations or people in the community like neighbors or building managers. Who are we checking on? So those heat vulnerable populations like we mentioned earlier, especially folks who have multiple risk factors and those who are socially isolated. So so based on sort of our conversations with community organizations, the big thing that came up is that they were wanting to know sort of some of those key considerations for developing check-in plans. So if we're going to be doing check-ins, whether you're working in an organization or whether or not you're just someone who wants to check on their neighbor, what are some of those basic things you need to think about when you're running check-ins? So when do we start check-ins? It's best to start checking on people when a heat warning or extreme heat emergency is declared, although we'll also talk about sort of potential indoor temperatures that might indicate wanting to check on someone who is more vulnerable to the heat. Ending check-ins, it depends, sort of heat vulnerable people may be at risk even after a heat alert is ended. We talked about that cumulative burden of heat. When overnight temperatures are high and the body's exposed to days of high temperatures without time to recover. So keep that in mind when you're trying to decide when to end check-ins. Frequency as well. So looking, ideally we want to be checking on people at least once a day, regardless of the time. We don't want to be prescriptive and sort of having people think, oh my gosh, if I have to check at 5 p.m., there's no way that I could possibly do that. The most important thing is to try to check on people at least once a day. Ideally, if it's a heat emergency or it's someone who is extremely vulnerable to heat, we're checking multiple times a day. There's pros and cons to when we may be doing those check-ins. Morning check-ins might give us an opportunity to do interventions or education and potentially prevent them from developing heat-related illness. Evening check-ins provide an opportunity to check on someone when it's the hottest part of the day. So indoor temperatures tend to peak a little bit later than outdoor temperatures. You think of our buildings heating up throughout the day. It takes longer for those buildings to give off heat, and they may continue to warm up our indoor spaces later into the evening. So even if it's starting to cool down outside, keep in mind that our indoor spaces may be heating up, and that could be a good time to check on someone who's heat vulnerable. So this is a helpful guide that was created by our colleagues at the BC Centre for Disease Control with the National Collaborating Centre for Environmental Health. It's for members of the public who want to do check-ins on people. Maybe it's their heat buddy. It goes through things like those high-risk populations, how to do a check-in over the phone, how to do a check-in in person, what are some high-risk temperatures to be looking out for, and what are steps we can take to help someone who's experiencing heat-related illness. This is the heat check-in guide that I helped develop for organizations. So it's a framework that helps groups develop their own check-in plans. It goes through things like common questions, organizational considerations, things like, documentation and, how do we deal with duplication or, different sort of handoffs between organizations. But this is something that can also be used in a variety of contexts. It could be used by, just everyday social services, faith-based organizations, or even groups of neighbors that want to get together and organize heat check-in plans. So the back of our document here, we also have about 5 pages of quick facts that go through sort of answers to common questions that we're hearing through our engagement with community organizations. Things like, what do we do for seniors? Or what about people with mobility challenges? What happens if there's, if we're having to call 911, what do we have to take into consideration? The back of this document also has 2-page workflow for heat check-ins. So you can see it a little bit there. It basically goes through those very simple steps of what are we assessing? If we see that someone's in heat-related illness, what do we do? And for providing education, what should we be telling them? What are some factors that we're looking at for environmental assessments of their space? We've tried to make it very simple, very clear cut, so anyone, even if you don't have health training, can pick up this sheet and have an idea of how to check on someone. So whether we're looking at ways to beat the heat ourselves or we're checking on someone else, here are some actions to cool down. So we want to seek cooler spaces, whether that's a cooler space within our home or going to a cool space in the community. We want to take cool showers or put part of our body in cool water. Like I mentioned, with lifeguarding, we used to go sit in the ocean between rotations, or, we used to put members of the public into showers if they were getting overheated. Maybe we wear a wet shirt or we apply damp towels to the skin. Drinking plenty of water and other liquids. Keep in mind that certain populations may not sense that they're getting dehydrated. So a good indicator for that is to ask people, have you looked at your pee recently? Have you looked at your urine? If it's clear or yellow or pale yellow, that's generally a good indication that they're staying hydrated. If it's dark yellow, that could indicate that they're getting dehydrated. So that could be a kind of a helpful way of checking how people are hydrating throughout the day. We want to be wearing loose fitting, light colored, breathable clothing. So it's maybe not some of those really thick synthetics, maybe it's more of the lighter cotton. We want to limit physical activity, and keep in mind that's not just going out for a run. That might be, work that we're doing, are we laboring outside with our profession? So trying to figure out, is there a way to reorganize how we're doing work during heat events? Can we do it sort of different times of the day when it's cooler? Can we, build in more breaks? We also want to monitor indoor temperatures and watch for symptoms of heat-related illness. The greatest danger during heat events is indoor temperatures. Here are actions that we can take to cool indoor spaces. So we want to, if possible, be using air conditioning or heat pumps. External window shading and external window films can be helpful. Part of with that is that we want to be trying to block some of that heat gain that's happening through windows. So, being able to close shades and blinds inside, as it mentions, that's helpful. External window shading is just sort of one step further. For example, I've got a neighbor that's got one of those bamboo blinds that they pull down on their balconies to block the sun from coming in. We also want to close windows during the day. So we talked about how indoor and outdoor temperatures peak at different times. The plan here is that we want to close the windows at around 10 a.m. when it's starting to get hot outside to stop that heat from coming into our space. And then similarly in the evening, we then want to open those windows up around 10 p.m. when it starts to get colder outside. So then we're able to then bring some of that cool air back into our space. We want to increase, if possible, some of that tree coverage on our spaces. Maybe you can buy a large tree to put up for the summer, or look at that as something that we could do long term. I often hear people saying that, oh, we need to go buy a fan in response to heat. I know some of those community organizations that I spoke with were looking at trying to get funding for fans. New evidence is showing that fans do not effectively bring down core temperature and should not be used as the primary cooling method, especially for heat vulnerable people. Instead, use fans as a tool. We want to use fans to help move some of that cool air into our space. So we talked about opening windows in the evening. Stick a fan in the window and use that to blow the cool air into our space. Our kitchen and bathroom fans often vent outside. So while you're blowing that cool air in from the window, maybe turning your kitchen and bathroom fans on to be moving some of that hot air outside at the same time. Ultimately, some of these tips for cooling spaces may only drop indoor temperatures by a few degrees. Heat risk for heat vulnerable populations starts increasing at around 26 degrees Celsius, and it significantly increases risk over 31 degrees Celsius. If you're in doubt, it's always best to try to get someone who's heat vulnerable to move to a cooler space if it's consistently hot in their indoor space. Now that we've learned some steps to cool our spaces, it's good to make notes of things you can do to prepare your own home or your heat buddy's home. Is there long-term features you can look at doing? So increasing greenery on the site or getting a heat pump. These are things that we can look at trying to modify that both this summer and then on in the long run as well. Thinking about people who have mobility issues, for example, or may have medical conditions. Is there people that you can help prepare their space? Maybe someone needs help lifting blinds and covers on their window. They may not physically be able to do that. So if you're thinking about preparing spaces, think about maybe also physically helping them do that. Similar to heat, here are some steps we can take for wildfire smoke to prevent severe symptoms. We want to hydrate, seek clean air spaces, stay indoors with the windows closed if it's not too hot out. We also want to limit physical activity and, if possible, use HEPA air filters. So to finish off, here are some additional Vancouver Coastal Health resources both for heat and wildfire smoke. For anyone in Vancouver, our team is working with the City of Vancouver doing an indoor air temperature survey. So in the summer of 2021, the City of Vancouver and Vancouver Coastal Health conducted a self-reported survey of indoor temperatures with support from the BC Centre for Disease Control. This information helps us better understand the relationship between indoor and outdoor temperatures and building characteristics across the region. The goal of this work is to help inform recommendations for achieving cool temperatures inside existing buildings and help prevent heat illness. To sign up, head over to the vancouvercoastalhealth.ca website. So a few other resources that we have here are our Vancouver Coastal Health posters. These were done in joint with Fraser Health as well. They're available in translation. So if you're wanting to have these posted in your building, or if you want to share them with neighbors or people in your community, this is a great resource. It goes through those signs and symptoms of heat-related illness, steps to cool people and spaces, and also actions to take if someone has heat-related illness. We also have our Vancouver Coastal Health Heat webpage that goes through a number of different resources depending on what your context is. We have resources for people who are healthcare workers, for landlords, for people who work in local government, as well as just members of the general public. So we definitely recommend checking those out. We also have a VCH wildfire smoke website that goes into recommendations for wildfire smoke and also links to our partners, including the BC Centre for Disease Control. We've tried to make our web pages as simple as possible. So for Vancouver Coastal Health, for our heat web page, it's vch.ca/heat. And for wildfire smoke, it's similar. It's vch.ca/wildfire. For forecast, notifications, and alerts, check out the Environment and Climate Change Canada resources. These are the public or the official weather sources in Canada. As I've talked about, there's confusions around terminology sometimes, and when some of these alerts are declared. So it's always best to go to official sources for information. They have got a couple of different options here. There's their public weather alerts that are posted on their webpage. So these are things like those special weather statements that we talked about earlier that let us know about weather forecasts and alerts in our region. There's also a WeatherCan app that you can download on your phone that will let you know about spaces that you've selected as your favorites across Canada, as well as the location that you're currently in. There's the Hello Weather, which is an automated phone service. So if you or a family member doesn't have a cell phone, or you prefer to call in over the phone, this service will provide you with forecast notifications and alerts. And there's a couple of different options there depending on the language that you prefer. So now I hope that you feel like you've completed your heat plan. So these are sort of all those steps that we go through in our Prepared BC heat preparedness plan. So looking at our space, looking at our, who we live with, people in our community. They also have additional recommendations for during heat events. So I definitely recommend that you head over to their website, look at the remainder of that plan. If you're wanting to give this out to people, or like I mentioned, run a neighborhood sort of emergency preparedness event, these are great. They actually come out as sort of a pamphlet that people can work through. So it's definitely helpful to keep those in mind for any heat events that we might be having this summer. So thanks so much, everyone, for listening, and I'm happy to answer any questions that you might have about heat or wildfire smoke at this time.
Thank you so much for that, Megan. It was a fantastic presentation. I hope everybody, I know I did. I learned a lot about that situation. I'm wondering if there's, Emily, maybe you'd like to jump in at this point, and if you have any questions or if there's any gaps that you'd like to fill.
Thanks, Chris. No, Megan did a fantastic job, and she provided most or all of the information that we have on our website and through our resources at VCH. So she's been doing some fantastic work on the heat check-in guide, and I would say for people to not hesitate to connect with Megan if there's questions about that guide and also our other work. But I'm really looking forward to the discussion here.
Fantastic. I want to make it clear to everybody that this presentation has been recorded. It will be available on the BC Lung website when that's been done. There was a question about whether the slide deck would be made available. Of course, with Megan's approval, that will also be made available once this is closed and finished. And hopefully that'll be done relatively soon.
Yes, for sure. I'm happy to send it over as soon as we get off here today.
Perfect. Just working backwards, I know there's a wide variety of people who have joined us for this fantastic webinar. And I think one of the things that has really come up is really around privilege and how that's affected what people can and can't do. And at a very baseline, one of the questions in our chat was around tinfoil, whether or not tinfoil is a very simple, accessible method for people to cover their windows. Does that really help in reducing heat in homes?
Yes, definitely. So that's one of our recommendations, is just everyday items that you can use. We do recommend trying to get cardboard and covering that with tinfoil. We want the tinfoil to be facing out in the windows, so it's sort of reflecting back that sun and keeping it out of our spaces. And then, of course, the cardboard just provides additional kind of blocking that way as well. So definitely something that you could be using in your home.
Absolutely. Are there other tips for people who just around the house, things that they could use to really help them if they don't have access to the air conditioner and they don't have access to some of the other tips that we've talked about?
For sure. So, even just thinking about trying to cool our bodies off, for example, we talked about trying to dip our clothing in water. Using water is seen to be one of the most effective ways to cool ourselves down. That might even just be if we don't have a bath, for example, or we don't have access to a shower, say we're camping or we're living in a trailer home, what have you. And maybe even just putting our feet into a cool bucket. So even having a cool foot bath can be effective as well at trying to cool our bodies down.
Absolutely. That's a fantastic one. Emily, I don't want to put you on the spot, but there is a question in the question and answer about clarifying some of the terms. I know one of your specializations is the technical portion of all of this. Do you want to maybe for the group explain maybe some of those clarifying terms?
Sure. Yeah, I can see that Armel was the one who actually who put the information in the chat. And so Armel's from Environment and Climate Change Canada, and he's actually the person that we look to for defining heat dome and atmospheric rivers and all of these other terms that we hear on a regular basis through the media, but may not fully understand. So I would recommend that everyone read the text in there that Armel has put in to clarify heat domes and heat waves and all of those pieces. And I would say that Environment and Climate Change Canada has been a fantastic collaborator with the health authorities through this heat work. And we work very closely together on this work. So that's another organization, if individuals have questions, can reach out to and ask those questions, as well as reading their online posts and so on and so forth.
Absolutely. I want to explore this concept around bringing neighbors together. And then, of course, the buddy system that's related to that, and the green space and being outside. I know, Megan, you touched in some detail about this in your presentation, but maybe just recap for us again the importance of the buddy system and how do you identify who that might be, and the importance of things like getting together and being in green spaces and things like that.
For sure. So I think it's one of those things that it's really becoming important across the province, and there's different groups that are actually focusing on this specifically. So there's some fantastic pilots that are happening with Hey Neighbor Collective, where they're actually going into buildings of neighbors and actually getting people together and facilitating discussions around doing emergency preparedness. Part of that is for heat. So it's sort of that social connectedness with the guise of emergency preparedness. So they're doing amazing work on Victoria, as well as moving over here onto the Lower Mainland recently. So I think that's definitely something we can do. So we know whether we're reaching out to neighbors. I think that was, not to say that there was any sort of necessarily upside to COVID, but I feel like in some ways that could be seen as one benefit. Is I think sometimes we saw our neighbors a little bit more when they were coming out. Maybe it was that 7 o'clock alarms and we were all cheering for healthcare workers, for example, or seeing people around their spaces more than we used to if they were working from home. So trying to take that opportunity to have a conversation with our neighbor, or maybe even a building manager, for example. We have talked to landlords, for example, this spring about work that they could be doing to try to foster neighbor relationships within people in their building, as well as things they can do as well as building managers to look out for people. So I think we have to be creative about this. It's not necessarily always going to be our family that people are relying upon. Who are those social connections that we seek out in our communities, and the importance of fostering those relationships more so than ever, especially as we're kind of looking ahead to climate change.
Absolutely. I just maybe scaling it back a little bit and talking about the heat events themselves. Of course, we've mentioned it before. It's been colloquially used out there in the media as well, as that we can expect more and more frequent heat events. Why does that happen? And what are we expecting perhaps for the rest of this summer? Without putting you on the spot and holding you to it.
I'll just say that we look to our colleagues at Environment and Climate Change Canada for that information, because they do the forecasting. Where, as the health authority, we provide the health information. They do the forecasting and modeling and all of that fantastic work. I will say that as our climate warms, it's the projections are very clear that we can expect more intense heat events, so hotter heat events, as well as heat events that become more frequent in our summers. So we can expect to see more of this as we're going forward, and potentially that increase in duration. But I would talk to Armel about that piece as well. So just to say that at the health authority, we recognize that there's very significant risk from heat to health of our population, and we're prepping for our future climate when we can expect to see more of this to come as our climate changes and warms. And I'll just put a little plug in there for the importance of both reducing greenhouse gases and also adapting to climate change, because as we see, these changes are already having dramatic effects. And if we don't reduce emissions significantly quite soon, it will be very difficult to adapt. So, and the other plug I just wanted to throw in there for 1 second was for outdoor shading, outdoor blinds, if it's possible in your home to put coverings on the exterior of the building. I just wanted to emphasize that point that Megan made, which is that these outdoor shades can prevent the solar radiation from getting into your building, and then reduce heat. When you have indoor blinds, you still get heat gain on those blinds in the interior of the home.
That's a good tip. A good segue really is, as you mentioned, climate change, and something that Megan also mentioned in her presentation, but I'd like to expand on now as well, is the relationship between heat and wildfires. So wildfires obviously changes the dynamic, although a lot of this is transferable. Maybe Megan, could you talk to us about the similarities around what we would do in terms of a plan when it's wildfire season and heat, and what some of the differences, the significant differences might be?
Yeah, so I think we are ultimately looking at trying in the long term to have methods to have both clean and cool air. So whether that's, filtrations that we can build into our space using heat pumps. So then if we are experiencing multiple events at the same time, we do have means to manage that. As far as sort of steps that we can take, definitely staying hydrated is one that we want to be using both for smoke events as well as for heat, trying to stay indoors, although monitoring those indoor temperatures when it comes to heat events, and then also checking on each other as well, right? So that importance of social connectedness, whether it's smoke or it is extreme heat events, just monitoring how people are doing, especially folks that are more vulnerable to both smoke and heat events. We did mention that there is quite a bit of overlap there between populations that are at risk for smoke and heat. So older adults, children, for example, people with particular medical conditions, trying to kind of even doing that, thinking ahead, trying to identify those people in your community, whether it's family, friends, neighbors, who are those folks that might be at higher risk, and remembering to kind of keep an eye on them if we have some of these events in the summertime.
Absolutely. We have a question that's just come in from an anonymous attendee. They wrote, I can envision there being more potential or opportunity for the social connection aspect as described in urban or neighborhood settings, like compact neighborhoods, as you described in your presentation. How do you suggest or envision that occurring in more rural and remote locations where people are not close together and may not know or see their neighbors often, if at all?
Yeah, that's a great point. I think there's been a lot of brainstorming around sort of this response, especially as far as check-ins, for example. And I think part of it too is trying to use some of our technology that we have, although I get that if we're looking at older populations, that may not necessarily always be an option, or if we're in rural and we don't have the same service as we do in other spaces. So for people who do have access to tech, there are people have talked about using technology that we have for overdose response, for example, people looking at, how do we check in over text message, or do we have an app for that? There's a discussion of, can we have an app for check-ins? So I think it's trying to be creative that way as well. I think if we're in more rural areas too, it might be more important too to have those check-ins and sort of built in. So do you have someone that you're regularly checking on? And if they don't hear from you, then they know that there's something to be concerned about, or trying to look more specifically at your space. So what is available in your community, and you might have to take more steps to be preventative, knowing that you might not have as many people around you more frequently. But then at the same time, I do think that sometimes folks in different communities have, different resources that they can access to. Talking to people, say on the Sunshine Coast communities, for example, they have less of that urban heat impact. So, or urban heat island impact. So they've got potentially more trees, or they're talking about, they often go down to the ocean or to go to rivers nearby, which isn't necessarily something that we can do as easily in some of our urban environments. So, we've got strengths in different places.
Absolutely. And always a good excuse to go check in on your neighbors. If you haven't met them already, it's a good opportunity to do so. You also mentioned apps, of course. You mentioned the WeatherCan app and other resources that are available for everybody. Of course, I mentioned off the top, there are resources on our website that are available. And I want to repeat, I believe it was vch.ca/smoke and vch.ca/wildfire for more information and more resources there. We have another question just coming in here. Will wearing masks or oxygen masks being outside be okay on poor air quality days with the fine and the particulate matter that's there? So obviously a mask wearing era that we've come through here. Is that safe and effective in terms of preventing the particulate matter?
I can respond and say that I would highly recommend that everybody go on to the BC CDC website for wildfire smoke. There's a document on there that describes the utility of masks for wildfire events, and it also goes through the details of what types of masks will be more protective and which ones will not, and then when things to consider when you're wearing a mask about lung function and those pieces. So it's a really, really great public facing document. And similar to other research, the document describes how, just wearing a t-shirt over your face may not really prevent PM 2.5 exposure, but moving into masks such as N95 masks can reduce exposure when you're outdoors.
Absolutely fantastic. I just wanted to clarify. I think I got one of those URLs wrong. I believe it's www.vch.ca/heat and vch.ca/wildfire for more resources. And of course, just as was both mentioned by both Emily and Megan, our friends at the BC CDC have a plethora of resources that are also going to be available that will really help on this topic as well. So with that, I want to close this. I really want to thank Megan and Emily for your time. The more that we can get out the information around what heat does to our bodies and what we can do to protect ourselves and our loved ones is going to be really important as heat exposure and heat events become more and more common for us. So with that, thank you very much. I want to thank everyone who took the time to join us today as well, and continue to be outside, live safely, and take care of each other. Thank you, guys.
Thanks so much.